Hi everyone, it's Emily and Lori. Today we're going to show you how we're creating and fixing asymmetry on male chest. First, as you can see, we have the marking around the area where we're going to treat. And then Lori's going to come in. She's going to prep that area. The pre-treatment wipe, just make sure we get any residue off that area and make sure it's nice and clean, ready for treatment. Fun fact, we are actually the #1 provider for men in the state of Texas. We treat male chest every single week. It's probably one of the main areas that we actually treat. Now, Lori's adding on the protective covering. So our gel pad, it's basically going to create a protective barrier between your skin and the applicator. It is made from cellulose, so it's going to be a little sticky, sometimes a little cold, but it has its job to do. So we've got that on there. I'm going to zoom in. Now we're using the Cool Advantage applicator. We're just going to suction that tissue right into the applicator. As you can see, we already have this one boppy down here. We want to make sure that we've got the cord stable because it is heavy, as you can see through here. We're going to get that second boppy underneath. Now this is a 35-minute applicator. Normally, if guys are treating both sides and not trying to fix the asymmetry, we can actually treat both at the same time, but since we're just focusing on one side, we've got one applicator on. But with 4 machines, we can definitely do both sides at the same time. There we go. I do like to use the towel just to, once again, give a little stability. There we go. Got that. Very good. And we're going to start our session. All right, 35 minutes. We'll come back and show y'all what it looks like when we take it off. All right. Okay, everyone, we are back. We're finishing up that 35-minute session right now on the left male chest. We're going to show you what it looks like when we take the applicator off and what to expect. During treatment, one thing we did not cover is that you can feel little butterflies from where the air gets trapped underneath that gel pad. It's normal to kind of have little pulsing movements, some people experience some burning, some mild burning, and some discomfort. But for the most part, it's pretty seamless, as you can see, and a pretty comfortable process. Especially here at DaVinci, we try to make it as comfortable as possible. So we're going to take this off. You can see how Lori stacked those boppies here. And I'm actually going to come up around over here so we can kind of see as it's finishing up what it's going to look like. Here we go. Very good. As you can see, we want to slowly pull it away. It's like taking a Band-Aid off. Here we go. That redness is normal. We'll see this immediately after treatment, and actually you can see that kind of central marking. That's from the gel trap that comes in, and that marking actually right there means that we had a very, very, very good treatment when you can see that. So that is completely normal. The redness will stay there for about 20-30 minutes post-treatment. Some people can experience redness throughout the day, kind of off and on actually. I can say personally that I had a little bit of redness throughout the day after my treatment as well. So,
but not on male chest.
Not on male chest, no. No, I did not do male chest. I definitely did not treat that area on myself. So, like I said, we can kind of look around here. See how it feels. And you're going to be numb in that area for the next couple of weeks too. So when you touch it, it is going to be a little tender. Some people can have a little bit of inflammation just from where that tissue was treated, but it does subside, and each day gets a little bit better as well too. But it's more just a tender, numb feeling than anything. There we go. Very good. Massage around. Now we also do suggest that you massage every day for the next couple of weeks, at least a couple of minutes a day. It will help with the sensitivity and numbness. And we can see bruising sometimes, but generally with the way we do our setup, our clients leave with no bruises. That is the goal here at DaVinci. So we're going to do a couple of minutes post-treatment massage. You'll be able to kind of see how that tissue moves around. Some guys will actually also treat into the side of the chest, which is called axilla, but for now, this client just needs straight center. There we go. Perfect. All right. In the massaging too, we generally do like to have you massage yourself as well. That way you get to practice in front of us. We can show you the proper techniques on what you want to do when you go home as well. So, because it is a very important part of post-treatment. Now, post-treatment, if you have itching, you can take Benadryl. If you have cramping, you can take Tylenol. So those are some things that people can experience, but once again, with just at home over-the-counter stuff, it can definitely help alleviate some of that stuff that you may experience. We do also send you an email with some post-treatment care. You always get a follow-up text and call from the DaVinci clinicians as well, just to make sure you're okay. Very good. All right. A great treatment.
What does he need to do at home?
Yes. The massaging, yeah. The massaging at home every day is the most important part for you to do. A couple of minutes a day for the first 2 weeks. And then some clients do like to do it in the next couple of months as well. We always tell you whatever you like to do, you can't over massage. So it's one of the most crucial parts to the post-treatment care. Okay. No garments are needed, anything of that sort. So it's a pretty easy process. You can resume normal activities. There's no limitations or downtime whatsoever. Okay. All right, very good. All right, very good. We're all done. If y'all have any questions, please feel free to give us a call at 713-609-1900. We'll be here to answer any questions you may have. Thanks so much.